everyone, my name is Robbie Omondi and this is Life 360. Once again, Life 360 talks about everything to do with health. But today, we want to speak about something called low ovarian reserve. And the little I know about low ovarian reserve is that it's a condition that could cause early menopause, or what is called premature menopause. But since I'm not an expert, I would like to introduce to you Dr. Sarita, who is a gynecologist here at Myra IVF Center, Nairobi in Westlands, and I would like for her to tell us something about low ovarian reserve. Karibu sana.
Thank you. I'm Dr. Sarita Sukhija. I'm a practicing gynecologist and fertility specialist. I was practicing at India for 15 years, and it's been almost 5 years now that I am in Kenya, Nairobi, and practicing at Myra IVF Center. So as she said, the low ovarian reserve, which is quite common nowadays because the girls are postponing pregnancy and they come to us when they are in the age of 35, 37, 40 sometimes, and they present to us what do we say? It's a low ovarian reserve, meaning the number of the eggs which are there in the ovaries which are left now, which can ovulate and produce a pregnancy, it's less. So there is a test which is called anti-Mullerian hormone, AMH, and it's freely available in all the labs. And I usually say to all the girls who are studying, who are postponing marriage, just go and get this one test done, which is called AMH. So the normal AMH range is between 1 and 4 nanograms per ml. And if it is less than 1, then you need to hurry up.
Little I understand about low ovarian reserve is that this happens to women who start their periods way younger than others. When we were growing up, people of my age, we used to start our periods at the age of 13, when you're almost in high school or when you're finishing your lower primary school. But now girls are getting their periods at a very young age. Kindly tell us how that is possible and how that eventually affects girls and now becoming or having low ovarian reserve.
So all over the world it is seen that the age of menarche, meaning when the girl starts period, it is going low. The girl starts period as early as 8 years or even 9 years. So I would say we can't say 100% that is the reason for the low ovarian reserve or early menopause, but it has more to do with the genetics. It is seen that whenever we see a low ovarian reserve, we should check the women, especially who are more than 35. So age is the most important factor, I would say. And then we ask for the family history. If the mother has had early menopause, then there are very high chances that the daughter will also have a early menopause and low ovarian reserve. Then the women who have undergone some kind of surgeries, the ovarian surgery especially, the ovarian cyst, or for any reason the ovaries has been removed or the cyst has been removed, then the chances are that the normal ovarian tissue has also gone out and it will reduce the egg reserve. The women who have undergone some kind of chemotherapeutic agents, who have undergone radiation, so all these things can again reduce the ovarian reserve, and these women need to go and check their fertility reserve.
Life expectancies and the lifestyle that we live now has really changed. How is that also affecting the levels and reserve of ovaries in women?
Yeah, so now it is seen that the diet and the stress, etc., which we see nowadays in the younger age group of girls, because there's a lot of pressure to do something. They want to have the good education, they want to have the good job, they want to be the CEOs. So all those things do affect the hormones in a female body, and that can also affect the egg reserve and the fertility levels also. A lot of young couples come that everything is normal, the hormones are okay, they are making an egg, the tubes are fine, but still they are not getting pregnant. So we tell them that of course they fall into the category of unexplained infertility, but sometimes just taking a break off from the work, we tell them just go on a vacation and try, and they come back pregnant. So stress does make a lot of difference.
When it comes now to these are young girls, most of them now have low reserve ovaries. Do you say now it's important for young women to get pregnant early, because now again we go back to the issue of young girls getting pregnant before the age where they're actually ready to become mothers? Where is the balance?
So what we do is we pull the embryos, and then when she is ready to have a child, then we can transfer 2 or 3 embryos, and if it results in pregnancy, well and good, but then still she has some embryos which are there as a reserve. So in these kind of patients who have low ovarian reserve, whatever dose of injections we give them, if there are 3 or 4 eggs, we'll only get 3 or 4 eggs. And then for the low ovarian reserve patients, we also have something very new called PRP treatment, which is platelet rich plasma, in which we take the blood of a woman and it is centrifuged and it is prepared in such a way that we can separate the platelet rich plasma and it can be put into the ovaries. It is something we are getting results in few women, and we do this treatment at Myra IVF Center. Especially for the Muslim class of patients who do not, if they have finished their eggs, who have low ovarian reserve and they cannot take donor eggs. So a woman who can accept to have donor eggs, of course we tell them that donor eggs will give them a better chance, but some women, because of the religious reasons, they are not ready to take. So we do have PRP treatment, we do have stem cell therapy, which I would say can give results in about 30 to 35% of patients, not more. It's not 100% again, but it is something which is new and it is not harmful. We can try.
Yeah. Thank you very much, Dr. Sarita. And if I've gotten right, the kind of treatments that are available, a woman can come and have their eggs frozen. There's a way also, I don't know if it's through medicine, that the ovaries can be stimulated to enable a woman now to have more ovaries for her to be able to conceive. Thank you very much for sitting down with me, and definitely to you, my viewer, I'll be able to put Dr. Sarita's contacts on the screen, and also make sure that you visit Myra IVF Center. If you have any questions, you can come to the clinic. It's at Westwood offices, and ask as much questions as you want, because matters to do with women health and fertility affects so many women, and most of the time we don't talk about it, either because of what society has put in our minds as expectations. But if you come here at Myra IVF Center, you'll be able to have all your questions answered, including the beliefs and religious beliefs that maybe pull us back. So thank you very much for tuning in. A big thank you to Dr. Sarita and Myra IVF Center for giving us this opportunity. We'll definitely come back for more insights on different matters to do with women health, fertility, and we'll be able to give you that. Thank you very much. This is Life 360. Until next time, bye-bye.